Welcome to America's Heroes Group.
And welcome back to America's Heroes Group, our roundtable with community outreach and partner AIDPH, otherwise known as the American Institute of Dental Public Health. Today is Saturday, November 19th, 2022. November is Military Family Appreciation and Alzheimer's Disease Awareness Month. Our host is Kelley. I'm Sean Claiborne, Army National Guard veteran and co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have our panelists on the line. It's Dr. Annaliese Cothron. She is the co-founder and executive director of the American Institute of Dental Public Health. She manages the program, the fund development, and overall strategy of the AIDPH. And we're going to talk about disparities facing the rural veteran experience. So, which is definitely an important topic, because one thing I read, and I wanted to go over this, and you might be aware of this as well. This is from, I got this statistic from Recent Trends, and it's an article, actually a medical paper that was written and published on the National Institute of Health, the National Library of Medicine, and it's titled Recent Trends in Rural Urban Suicide Disparity Among Veterans Using VA Healthcare. And they found a higher rate of suicide in rural VA users than urban VA users overall, 33% versus 29% versus urban areas, 33% rural versus 29% per 100,000 population. But the age, sex, and race-adjusted rates conversion 2005, white VA users had over triple the rate of death by suicide as black VA users and lived disproportionately in rural areas. So I thought that was a pretty interesting fact that they were able to uncover just by looking at the VA numbers from the VA hospital, VA system. What can you tell us about the disparities, and what do we need to take action on with this?
Yeah. Hi, Sean. Thanks so much for having me. I'm so excited to be here. Yeah. And I appreciate everybody at America's Heroes Group. Thank you all for your service. Obviously this month was Veterans Day. It's also Military Family Month. It's also National Rural Health Day on November 17th, which is why we're so focused on rural veterans here at AIDPH, since there are a lot of overlapping and intersecting days to celebrate throughout the month of November. And so you're right, rural veterans are experiencing disproportionate burdens of disease and disability as compared to urban veterans. And so this is why we're uniquely focused on rural veterans throughout the month of November. Our data collection has been focused on rural veterans. And that's because rural veterans are also more likely veterans are more likely to reside in rural areas. A lot of people don't know that. Mm-hmm. So rural veterans are a key area of focus for us. There are about 4.7 million veterans living in rural areas. And rural veterans are actually more likely to get care in the VA, which is why you're able to pull data like some of the ones you just cited, so that we can understand rural veterans. AIDPH has actually been focused on rural veterans for quite some time through our research and our survey research. We're releasing some publications later this month on rural veterans from our survey research. We also analyzed data from the Behavioral Risk Factor Surveillance System in August, and we looked at some unique challenges that rural veterans face in regards to their oral health. So it's a pretty important topic to us. Recognizing that this is a particular population that needs to be focused on throughout the veteran population. And we also know that rural Americans in general, just all rural Americans, struggle with accessing care. There are a lot of unique disparities faced by rural Americans, so it's a pretty important topic.
One thing I also found by doing a little bit of research on this topic, and a lot of veterans and VA systems commented on this, and one thing they said as a common story was a lot of rural veterans not accepting care or trying to do it on their own, so to speak.
Yeah, I think we've seen some echoes of that in some of the data that we've looked at for rural veterans. We looked at veterans self-reporting all types of different healthcare outcomes or chronic disease conditions. So we actually asked veterans if they could self-report things like mental health days, diabetes, heart disease, et cetera. And then we also looked at data sets where there were kind of clinical guidance pieces, where it was actually confirmed through clinical examinations. And what we found is that, rural veterans are less likely to self-report in some ways, like having poor mental health days. But we also know that rural veterans are also pretty vocal about saying, we want access to care, and we want it in a way that makes sense for our lifestyles, where it's convenient, where it's co-located. where we can go and experience a holistic form of healthcare. And so I think that's why it's important to focus on the needs of rural veterans. But realistically, there are a lot of things that rural veterans are asking for that would probably benefit all veterans too, like expanded eligibility for dental care through the VA. An important piece of our research has actually revealed that most rural veterans, that we surveyed, they were getting medical care in VA facilities. And in fact, they said they were really satisfied with the medical care that they were getting in VA facilities. The problem is they weren't eligible for dental care. So it's not uncommon for a rural veteran to go to a VA facility to feel great about the care that they're getting there and then just not able to access dental care at that same facility because they're not eligible. And so this leads to some pretty profound and significant oral health disparities. One thing that we noticed in our research, which was pretty significant, was the rates of what's called edentulous. And edentulous means that you've lost all of your natural teeth. It's pretty significant. We obviously want folks to keep all of their teeth. It's really important, and we use that as a metric of severity. It's kind of like the final metric of poor oral health outcomes. And we examined edentulous both in veterans versus non-veterans, and then rural versus urban veterans. And rural veterans actually had the highest rates of edentulous of any of those demographics that we looked at. And in fact, we noticed that it's exacerbated by chronic disease conditions like diabetes and heart disease. And unfortunately, we know that rural veterans are more likely to have those chronic disease conditions. So it creates this kind of overlapping effect for rural veterans. And unfortunately, it's leading to more severe health outcomes as a result.
Wow. So how can people help rural veterans expand access to dental care?
I think that's such a great question because a lot of times the solutions for rural veterans look like the solution for every veteran, right? We know that rural veterans, just like any veteran, just like any American, is experiencing dental care in this very fragmented and siloed way. We know that it's very difficult sometimes for rural veterans to access care, but then you go to the dentist and how are you going to pay for it? Even if you do have dental insurance, it could be really high co-pays. This is not uncommon for any veteran to experience or any American to experience. We just know it's those barriers are more profound for rural veterans. And so our first and foremost call to action is to expand eligibility for all veterans to receive dental care through the VA. What's important, and I kind of noted how all of these different chronic disease conditions kind of overlap and intersect, and we know that whenever rural veterans and any veteran are able to experience integrated health care through a comprehensive and whole person healthcare approach, it's actually going to solve a lot of those overlapping issues, right? So diabetes can be treated in the same health system. Your heart disease can be treated in the same system. Your dental care can be treated in the same system. So having all of that filter in through the VA is actually going to not only result in better health outcomes, but it actually results in a massive cost savings. So, telling your member of Congress that you want to see expanded eligibility through the VA is really important. I know sometimes it can feel like, I'll call them or send them an email, and it feels like you're kind of screaming into the wind, right? Like nobody cares, nobody's listening. But I can tell you that they do, and they keep those things. And when they hear from constituents and when they hear from veterans in particular advocating for themselves, saying, I haven't seen the dentist in years, like I have, pain in my mouth and I don't have functioning, I feel self-conscious smiling. All of those things make a difference to your member of Congress because ultimately the only entity that's holding back expansion of VA dental care is Congress.
Really?
They have to vote on that in order to change the federal code and expand the eligibility criteria. So it's really important for you to make your voice known to your elected officials that this is important and you want to see change.
So why is Congress the stumbling block to this expansion? Because it seems like common sense in a lot of different ways. And then also even in Medicare, the same issue persists unless you have a Medicare C plan, like an Advantage plan. They don't connect dental health with health when reality is dental health is health.
Right. Yeah, you're absolutely right. I think this is actually a pervasive issue that goes outside of the VA, as you just mentioned. This is an issue in a lot of states with Medicaid, where Medicaid will cover medical conditions, or it'll cover just children and dental care for children and not adults. And we see this in the Medicare system, too, and in the VA. It seems like it's really, really difficult to get traction of folks just acknowledging that oral health is part of overall health. And we have this saying in dental public health, which is we want to put the mouth back in the body, right? Mm-hmm. Like the mouth is the gateway to the rest of the body. And everybody deserves to have good oral health, right? You deserve to be pain-free. You deserve to feel good about your smile and the state of your mouth and teeth. And so it really does go beyond just saying, oh, I have a white smile, or, oh, I've been able to access a cleaning. There are these really big, profound experiences that we've gathered throughout the past couple of years of veterans who don't have access to dental care. And they're saying things like, it's hard for me to find a job because I don't smile during job interviews, or I actually can't relate to my coworkers very well because, I look gruff or I look tense, and it's simply because they feel self-conscious about smiling or, being close with coworkers. And so we know that these have pretty profound economic impacts that, again, it's not just for veterans, it's for all Americans, and we certainly understand that. But right now, our healthcare systems are not set up for most people to get affordable and effective dental care. And we know that feels just, it feels even more triggering, right, when it comes to veterans, especially when we're talking about military families, when we're talking about rural veterans, and we're celebrating Veterans Day, to know that so many veterans are experiencing, kind of this crisis with not accessing dental care. It just feels really unconscionable.
Ron, you touched on this, but when you think about it, if the veteran's not getting dental care, that means chances are their family is not getting dental care, which includes their children, their spouse, and then that becomes a cycle, a perpetuating cycle. If the kids grow up without dental care, then they don't know much about it. So how would you recommend to veterans to improve their access to dental care? What would you say to them to help them get access?
Yeah, I like to recommend a few different venues. I mean, obviously, besides self-advocacy and telling your member of Congress that this is important, I think it's actually really important, too, to link up with advocacy groups like the VFW, your local American Legion or your local VFW. At AIDPH, we've actually worked very closely with them nationally when it comes to expanding access to dental care for veterans and trying to push policies that will do that. So having, more people in their network to be able to strengthen that case to Congress is important. But I would also say, too, whenever I work with veterans who may reach out to me who are struggling to get access to dental care, I like to remind folks of a few different programs. One is the Community Care Network. So if you are, eligible for it, you can get care out in the community and meaning outside of the VA, and you can get care. Now, that's just the veteran. That's not the family, but you can get dental care for that. Veterans may also be eligible for the VA Dental Insurance Program, or the VA DIP. And it's a private insurance program. Depending on where you live, there's a private insurance company that would be in charge of administering that benefit. But it has lower premiums, meaning lower out-of-pocket monthly costs to be able to access that dental care. And that does have some options, I believe, for family members. So it's always something to look at. That was actually authorized by the 2018 Mission Act. A lot of veterans don't actually know that this program exists. And so I've actually worked with veteran advocacy organizations a lot over the past couple of years who just said, I didn't realize that this was even a thing. So I like to promote that there are some opportunities to get dental care coverage. There are always going to be limitations with all of these options. So that's why we say, first and foremost, Congress needs to expand eligibility through the VA. But if you are looking for other opportunities and outlets, those are a few, along with your local community health center. So federally qualified health centers, or FQHCs, are actually mandated by accepting federal funding to accept all patients regardless of their ability to pay. So that means you may have options on a sliding scale. You may have options to not pay at all for your care. And we highly recommend seeking out an FQHC if cost is a problem for you.
So what else does AIDPH have in store for veteran oral health care in the future? What are you guys working on now?
Well, right now, like I said, we're hyper-focused on rural veterans, and we've been pretty lucky to both analyze the data that we have available from our survey last year, and also we've launched another survey this year in partnership with the VFW. And so we actually have that out in the field. You can go to our website, aidph.org/veterans, and you should be able to see the survey if you're interested in taking it. We actually pride ourselves in the community that we've been able to build with veteran advocacy organizations. And so we have some of the largest amounts of data outside of the VA. And again, most veterans are not accessing care in the VA, so we're getting really a unique sample that the VA doesn't really have access to. And so that's why it's important for us to keep doing this research, because in the next Congress, we fully expect to be able to go back to lawmakers and say, this is what, these surveys are telling us. This is what veterans themselves are telling us. They're telling us that they're suffering in these ways. They're telling us they can't access affordable dental care. And in particular, rural veterans are kind of bearing the brunt of this lack of access to care. And so that's really next on our plate, is ensuring that we kind of take these subsets of the data that we have available. And then on top of that, we plan to give all of this data to members of Congress and back to veterans themselves. So if you still go to our website, aidph.org/veterans, and you scroll all the way down, you'll be able to see a data dashboard of all of the veteran oral health data that we've collected last year, and we're working on this year's data. And the goal of putting that dashboard together is actually to democratize our data. We want veterans to be able to look at this data if they so choose, and then say, what does this mean to me? What does this mean to my community? How can I advocate for myself? We think it's really important for organizations to be able to, find the insights that work for them and apply our research in ways that we can't even think about doing, because we don't have all of the answers to everything. We really want community support and community insights. So I think that's what we're focused on, over the next few months until we have new members of Congress installed, is really putting out the data so that when we go to lawmakers, they have all of the information ready and available to them to show not only is this needed, not only is this effective, but it's also going to save money in the end. That's what I keep bouncing back to, is whenever we speak to members of Congress, our data are really clear that giving access to dental care for veterans, that, especially through prevention, actually saves billions of dollars a year with a B.
Wow.
And the VA's oral health budget, their dental budget, is only, it's a little over $2 billion. And our calculations indicate that we can save about 4 times the VA's budget just by giving prevention to veterans, especially those who have chronic disease conditions like heart disease and diabetes. It's a massive cost savings. So to me, this is a win-win for veterans to actually get in, get the care that they need and the care that they desire. And at the end, it actually costs taxpayers a lot less.
And that should get a lot of people engaged. If you're talking about saving taxpayers money, taxes and inflation are high enough as it is this year. People are crying about losing money. If the Congress do one thing, if anything, especially something that benefits people, is to do something that's going to actually save the American taxpayer money and at the same time improve the lives of veterans. And as you mentioned before, is that these models, these types of changes, these incubator programs, if you want to call it that even, inside the VA system, end up finding their way to be proven things that could be done in the civilian world. So we can maybe apply some of these things to Medicare, apply some of these things to what's going on in the civilian population to save money even further and improve the lives of American citizens across the board.
Right. I think that would be great. And, with the cost savings that you could see from expanding access to dental care through the VA, you can then reinvest those dollars into much needed infrastructure, kind of thinking back to rural veterans in particular. We've talked about lots of telehealth options. And since COVID happened, I know telehealth has been something that a lot of folks have been able to take advantage of, being able to FaceTime with a doctor, Zoom with a doctor, have some kind of portal where you can share information back and forth. And doctors are certainly more adept at accessing, those types of electronic health portals. But the reality is that many rural folks are living without broadband access. They're living without basic infrastructure. About 25% of rural folks are living without that needed infrastructure to engage in things like telehealth. And when we think about rural veterans, and any rural Americans, but rural veterans in particular, if you are, unable to get to a doctor because they're 75 miles away from you, and then you also don't have access to telehealth because you don't have broadband and there's no infrastructure built around you, that really takes all of those complicated issues and makes them really, really challenging to deal with. And all of the solutions that we know work really well other places may not be available in rural areas because of the lack of infrastructure. So, there's some ways that you can reinvest those cost savings back into infrastructure that would then probably lead to more health savings, right? So if rural veterans are able to engage in things like telehealth and teledentistry and use that as a resource as needed, then that's also averting unneeded dental appointments, unneeded health appointments, because you're able to take care of things through triage or, just through communication with your provider. And I think we could really improve the system all the way around by reinvesting in these kind of proven practices that allow for more accessible care.
So any final thoughts on what you want us to know about rural care? And then also reiterate again, if you can, please, what people can do to access, where they can find these organizations and groups and veteran service organizations that can help them out to get access to dental care.
Yeah. If I could leave you with some closing thoughts on rural veterans. One, I would just remind folks that veterans are disproportionately located in rural areas, right? So veterans are more concentrated in rural areas, and so we really need to figure out solutions for rural veterans and rural Americans across the board. As a reminder, I'm not sure I said this when I first came on, but the statistic that I want everybody to keep remembering is that 85% of veterans are not eligible for dental care through the VA. And of that, 15% that are eligible, only 1/3 utilize the benefit, either because they can't figure out how to access it, they don't know how to access it, don't know if they're eligible. So there's a lot of complications here, and most veterans are not getting dental care through the VA. So first and foremost, we want Congress to change the federal code to expand eligibility through the VA. And to your original question about if you are eligible, not eligible, et cetera, kind of figuring out those benefits, there are community care programs that you can look into, like federally qualified health centers. You may actually be eligible for the VA dental insurance program. And then we also have some nonprofit organizations highlighted on our website, like Everyone for Veterans and Dental Lifeline Network, where if you have, some complicated needs, that your dental care may qualify for free services through those national nonprofits that do a lot of really good work. So I would certainly say, number one, is expanding eligibility, since 85% of veterans don't get access to dental care through the VA. And then we also know that there are a lot of nonprofits and a lot of organizations sort of standing in that gap, ready to support veterans.
And to get that to your website, to get some of these resources, to get information about those resources, is the website, once again?
AIDPH.org/veterans. You can reach us there. You can contact us through the contact form. It'll make its way to me. So if you really do need help, we'll do everything we can to connect you to the resources that you need.
Mm-hmm. So we got a couple more minutes left. So when we look at what's going on in the healthcare and with the dental industry, and what's going on with dental care in rural communities, one thing that comes to mind when I think about this is the fact that the rural communities always seem to be cut out of the conversation with a lot of different topics. And when you mentioned a couple of things that made me think about it, because you said basically that there was also a lack or a problem with broadband internet access, which it's almost like, to me in today's age, it's like cutting off a telephone line back in the 80s. You know what I mean?
Right, exactly. Yeah.
It's like, broadband reliability is huge in today's world. So then it puts people at a disadvantage to try to access certain things. Trying to get to your website. That could be a challenge, just thinking about that. Mm-hmm. Are there any community outreach initiatives that you know of to help veterans in rural communities get to get access to different things and be able to research and get information more effectively?
Yeah, I think that's a great question because some of it depends on where you live, right? So I always recommend folks reaching out to their local veteran service organizations, and there are usually a lot of them, maybe not in rural areas, but a lot of them have access to these kind of like wraparound services so that they can try to meet transportation barriers, childcare barriers, cost barriers potentially through grants. So I would always first figure out like what's available in your local area. And, I think you bring up a good point, too, about rural veterans in particular having all of these unique barriers, but also just the fact that rural Americans are living in crisis mode. We've heard so much about critical access hospitals that have been closing in rural areas without the needed infrastructure, then complicated by lack of broadband access. We realize that rural Americans are experiencing these really significant health crises that were certainly exacerbated by COVID. And so I think it's really a holistic issue that we need to revisit all the way around, saying, yes, of course, rural veterans need more social support, need more access, need more infrastructure. And that would really benefit all rural Americans if we could figure that out.
Dr. Annaliese Cothron is a co-founder and executive director of the American Institute of Dental Public Health, otherwise known as AIDPH. Go to their website, aidph.org. Did I say that right?
You did.
And that's /veterans.
Veterans, that's right.
All right. So thanks for coming back. And don't forget, people also go to our website, americashg.org, and then look for Annaliese's, Dr. Cothron's previous shows, because a lot of that has a lot of good information about how you can access dental health and also some important things on how to get Congress to change what's going on in America. We need to get on this and become an army of veterans to start making changes for ourselves, because it's not just about us. It also changes and affects and helps the American people as a whole. Thank you for your time.
Thanks, Sean. I appreciate it.
Appreciate you. This is America's Heroes Group. We'll be right back.